Hi, it's Wendy from Pacific Northwest Aesthetics Academy, and today I wanted to talk about violence in the healthcare setting. What really alerted me to this and made me want to address this is a video that I saw on social media that is a couple years old from a medical office, or it looks very similar to many emergency departments that I've worked in over the last 25 years, but this one actually takes place in Russia, which I didn't know when I first saw the video. It looked like any emergency department in the United States, and it featured a drunk patient who was sitting in a corridor waiting to apparently be brought back to the emergency department. And then what I saw next horrified me. It actually was really difficult to watch, mostly because I saw myself in that scenario, and that could have been me on so many occasions. And it was a healthcare provider who was dressed in a white lab jacket speaking to the patient, and you can see there it's quite heated, and the patient actually gets up and starts assaulting this medical provider. And then what you see next, how it unfolds, is that this medical provider is actually another person comes out of the emergency department as their coworker is being assaulted, and then they get assaulted, and it just escalates from there. And like I said, it's horrifying. And I was talking to Amelia Roberts she's a visibility expert, and she has a company called Solutions by Amelia, and she's out of Washington, D.C. And I really encourage you to look for her on LinkedIn and follow her on Instagram. And we started a conversation about how in the medical community, this kind of thing is just taken for granted, like it's nothing. And in any other workplace, this would be a reportable incident. And how horrifying it is that this is acceptable behavior in where we work. And I said to her that I don't know if I would have chosen the healthcare field to go into if I had seen that video as a 20-year-old nursing student. That would have really made me think twice about this career that I was entering into. I probably would have chosen a different line of work. And now thinking about all those situations that I was in the emergency department, and I had security personnel at only one of the many hospitals that I worked at, and I felt very safe with them. However, the other hospitals I worked at, I often felt unsafe, and I didn't have any security personnel on staff. And what I was told was that if I felt like I was in a dangerous situation, that the police would be there very quickly. And this was supposed to placate me and make me feel comfortable and okay in that setting. And it really never did. And I just really am so thankful and grateful that I never was physically assaulted in that way. Verbally assaulted, yes, many times in the emergency department, but never physically assaulted to the extent that happened to this medical provider that I saw in the video. And as nurses, we really need to feel more empowered that that's not okay, as any medical provider should feel that that's not okay. Not only that, but as medical providers, we aren't stuck in this career. It's something we chose to do. So having that knowledge, and then also having the knowledge that there's other things to do out there. Yes, you may have been trained as a nurse or a nurse practitioner or a physician's assistant or a doctor in a specialty area perhaps, but that doesn't mean that you can't choose to go down a different path. It doesn't mean that the knowledge that you've accumulated over however many years is not applicable in another setting, and it is. The interactions that you have with patients day in, day out, the things we learn along the way that we didn't learn while we were in school are hugely applicable to many other areas of healthcare. Luckily for me, I found this fabulous world of aesthetic medicine, and it has been a gift. And I will forever be grateful for the process that enabled me to get where I am today. Thankfully, it didn't take a horrible, violent incident to send me down that path. There were many other factors that did, but it wasn't a physical assault. I do have many coworkers who have been assaulted in the healthcare setting, and how they stay in that setting just really astonishes me, and I admire them for that, because we do need acute care. We need bedside providers for sure, but really for those people who have had it, who can't cope with another day of going to the hospital or dealing with patients or whatever aspect of their job that has really made them hit that proverbial wall, there are other options, and I encourage you to explore them and tap into what you have inside of you that fires you up, that motivates you, and hopefully you'll look forward to going back to work, and you'll look forward to getting up every morning and going to work and taking care of people in whatever specialty you want. Thank you so much for watching this video. Please subscribe to our YouTube channel, follow us on Instagram and Facebook.